We also are very proud here in California. We had incredible leadership that is demonstrable in the state by Cesar Chavez. That leadership was recognized formally as this day is every year, Cesar Chavez Day. And in the spirit of contribution, the spirit of service, in the spirit of meeting this moment, we are also announcing an effort to do more and do better to protect our seniors in the state of California. We have 5.3 million Californians that are 65 years and older. And we've been doing some remarkable things at the local level to check in on our seniors, wellness checks to make sure they're getting their medications, making sure they're getting their prescriptions. But we need to step things up significantly. And that's what we are announcing here today, a statewide initiative, working with our partners at the AARP, working with our partners at Alzheimer's, American Lung Association, Cancer Association, Heart Association, working with our local partners, our CERT teams that are part of our mutual aid program, traditionally utilized in preparation for our wildfire seasons, our Listos program, which we rolled out a few months ago to do the same. We're now reconstituting all of those programs and building capacity and partnership to significantly increase our connectivity to our seniors, to check in not just for wellness checks related to food and medicine, but the deep anxiety people are feeling, being isolated at home, and the loneliness people are feeling at home, not connected to the outside world, anxious about their life and their loved one's life. And so neighbor by neighbor, we're asking people to make 5 calls. We've worked in social media platforms next door to do just that in 22,000 neighborhoods across the state. We've already connected through that platform just shy of 8 million individuals, but we have to go deeper and we have to do more. And we have to do it in a way that not only just checks in on someone to see how they're feeling, but be able to deliver something on the back end, not just a meal or medical supplies. And that's why we've created a hotline for people across the state that will guide them to more substantively deliver on the needs of the individual they're contacting. And that site has a following number, 833-544-2374, 833-544-2374. That hotline will allow individuals to be able to get questions they may have answered in ways that they can individually participate in helping support this moment in the spirit of civic contribution, in the spirit of the commonwealth, in the spirit that defines this moment, that we're all bound, as Dr. King said, bound together by a web of mutuality. And that commonwealth, it is incumbent upon us to check in on the greatest generation. People have brought us the world's most vibrant middle class and obviously have done so much for all of us. We have a unique obligation to do more for them. But in that spirit, to be able to do more, we need not just that one point of contact, that one hotline. We need to be able to drill down in a more substantive way. And so we've partnered with our 211 system. Our 211 system is an incredible system in the state of California that connects people to real services in real time. So if a loved one or a neighbor or a stranger is in need, and they need something more than just nice words and just a check-in, but need specific services, we partner now with 211 to provide those services at the local level all throughout the state of California. I'm going to
We're just hearing Governor Gavin Newsom giving an update on the state's response to the coronavirus pandemic and the outbreak. The governor announcing a new hotline, 833-544-2374 for anyone to call that number to help older Californians during this pandemic to get some help.